Hello, everyone. Today we are going to review personal protective equipment, also known as PPE, used for COVID-19. The most important PPE we can use is face covering, also known as a mask. Masks protect us against COVID-19 by preventing respiratory droplets from traveling through the air when we speak, cough, or sneeze. It should be noted that all face coverings are for individual use only and should not be shared. A good face covering fits snugly against the side of the face, can be secured with ties or ear loops, and includes multiple layers of fabric. A good face covering also allows for breathing without restriction, covers the nose and mouth, and can be laundered and machine dried if it is reusable. When choosing a face covering, you may choose from a disposable or reusable face mask. A disposable face mask is good for a short-term, temporary use face covering. Cloth face coverings can be reusable as long as the integrity of the cloth is intact and is clean. If the elastic ear loops do not stretch or hold the mask in place, it is time to replace that mask. If using a reusable face mask, it is important to keep your face covering clean and wash it periodically, especially if it's visibly soiled. Masks may be cleaned in the washing machine with regular laundry. The CDC recommends using regular laundry detergent and the warmest appropriate water setting for the cloth used to make the mask. Masks may also be washed by hand. The CDC recommends preparing a bleach solution by mixing 5 tablespoons, or 1/3 cup, household bleach per gallon of room temperature water, or 4 teaspoons household bleach per quart of room temperature water. Prior to use, you should check the label to see if your bleach is intended for disinfection. Some bleach products, such as those designed for safe use on colored clothing, may not be suitable for disinfection. Ensure the bleach product is not past its expiration date, and never mix household bleach with ammonia or any other cleanser. Once the mixture is prepared, soak the mask in the bleach solution for 5 minutes. Rinse the mask thoroughly with cool or room temperature water. Be aware that the bleach solution may fade colors on the cloth. Once clean, the CDC recommends that you dry the mask in a dryer or air dry. When drying the mask in a dryer using the highest heat setting, leave the mask in the dryer until it is completely dry. When air drying, lay the mask flat and allow it to completely dry. If possible, it is recommended to place the mask in direct sunlight. One of the best ways to prevent the spread of COVID-19 starts with hand washing. Schools and businesses should teach and reinforce effective hand washing with soap and water for at least 20 seconds. If soap and water are not readily available, hand sanitizer that contains at least 60% alcohol can be used. Similarly, staff and students should be encouraged to cough into their elbows or cover their coughs and sneezes with a tissue. Used tissues should be thrown away in the trash, followed by hand washing. When wearing a mask, be sure to wash your hands before putting on the mask. Place the mask over your nose and mouth and secure it under your chin. Try to fit the mask snugly against the sides of your face and around the bridge of your nose. Make sure you can breathe easily while wearing the mask. To take off the mask, untie the strings behind your head or stretch the ear loops. Handle the mask only by the ear loops or by the ties and fold outside corners together. Place the mask in the washing machine. Be careful not to touch your eyes, nose, and mouth when removing, and wash hands immediately after removing. For more information, the Centers for Disease Control and Prevention offers additional information on the best practices for wearing a face mask.